هسه كل الجروب هذا تسمع؟ تمام. Okay, let's start. So as I said previously, every lecture has a continuation of the previous one. So the 4, 5, or maybe 6 lectures at the beginning will be all about physics and matter and production of X-ray. And now we are going deeply to talk about factors controlling the X-ray beam and then interaction of X-ray with matter. Matter we mean in our field will be human and the body. And in the next lecture, we will talk about uh, not physics, the radiobiology and interaction of the X-ray with the body. And then we will talk about radiation protection. And then we will start in future to talk about the techniques and more deeply in the dental X-ray techniques and films and images and everything related to future with X-ray. But if you don't know these basic principles, you will not understand what we mean in the future by density, contrast. If you don't know the intensity, if you don't know what we mean by KVP, what we mean by milliamperage, what we mean by exposure time, what we mean by scattered radiation, what we mean by absorption, all these things are related to each other. So it's not like just jumping and starting talking about film and like the epical technique or panorama or CBCT or any other techniques related to dental radiology without knowing the basics things. So before starting with radiation characteristics, whenever you hear or you see anyone talking about exposure parameters, exposure parameters include these three things: tube potential, or what we say voltage, and the unit is kVp, kilovolt peak. Tube current, التيار, and the unit is milliampere because ampere is too much, so milliampere. And exposure time, the unit is second, but what you use in the dental radiology is the milliseconds. So whenever you hear about exposure parameter, it means tube voltage, tube current, and exposure time. All three these together called exposure parameters. So older dental X-ray units or machines, the individual exposure parameters of kVp, MA, and time could be manually changed. الأجهزة القديمة عادة كانت تجي الKV والMA والexposure time, you could change these manually. But now, adjustments are not possible for KV and MA. Only you can adjust the exposure time. أعتقد جهاز اللي عندكم بالقسم هو نفس الشيء. You can choose upper, lower, which tooth you want. So the device automatically will change the KV and MA embedded with the device in the control panel, and you just can govern or change the exposure time. Why did they do this? Because they reach the studies and money research, they reach like a deal or a agreement, the scientists, that, for example, upper anterior teeth need this amount of KV and MA, the posterior, this, and the lower upper, each segment or each side or each tooth need like an amount of KV or MA. They just can manipulate the exposure time according to patient's body or the site. These are just information for you. So variation in character of X-ray beam at the end, when we have KV, MA, exposure time, each of these, the X-ray beam will be different. Increasing exposure time, the beam will be different. Increasing KV or MA, all these character exposure parameters have effect on the X-ray beam. So it will influence the quality of resulting radiograph. Of course, when you use high KV or high MA or increasing the exposure time, you will get a darker film. When you have these parameters lower, you will get with low density, more lighter film. But we have to reach an agreement of an image to be resembling the area of interest, not too light, not too dark, to see the density and the contrast. So radiation characteristics, we have three characteristics of radiation. X-ray beam quality, X-ray beam quantity, and X-ray beam intensity. We will talk about these today. What we mean by X-ray beam quality? We talked about tube head, cathode, anode, and everything. Now, if you have ever seen or have reviewed previous lecture, it will be easier for you to follow this lecture. If don't, you may struggle with this one. So I always say try to have a look to previous lectures to continue or to hang with me with these informations. Otherwise, you will be late. So X-ray beam quality refers to the average energy or penetrating ability of the X-ray beam. Energy or penetrating ability. And this we talked about, it depends on wavelength. Wavelength determines the energy and penetrating power of radiation. We said X-ray have a short wavelength, high frequency, and high energy, consequently high penetrating power. X-rays with shorter wavelength have more penetrating power. And that's why, if you remember, we talked about filter, aluminum filter. And what this aluminum filter do is blocking the longer wavelength. So just leaving the shorter wavelength to go through it. At the end, we get X-ray with more penetrating power. So see, there is a communication with previous lectures. X-rays with longer wavelength have less penetrating power, so it will not add to the image. It will just harm the patient, these with longer wavelength. That's why we use filtration. So X-ray beam quality is controlled by tube voltage. Remember, the quality controlled by tube voltage. And we say the kVp is the unit. So it's maximum or peak voltage. kVp, remember the previous lecture again. kVp regulates the speed and energy of the electron and determines the penetrating ability of the X-ray beam. Dental radiography requires the use of 65 to 100 kVp. So no less than 65, no more than 100 kVp. Why? Less than 65 kVp, so it will deliver X-ray with less penetrating power. So it will do harm to the patient rather than getting benefit by doing a radiograph. And more than 100 kVp, it will result in over-penetration. Again, it will harm in a way the patient and will be over-penetration. And in the last slides for today, I will show you the effect of the X-ray when it hits matter. So this increasing the kV will not add to our aim to getting a good radiograph. This was about the quality. Now, X-ray beam quantity. What do you mean by that? Refers to the number of X-rays produced in the dental X-ray unit. The first one was about speed and power, penetrating power. An increase in the number of electrons available to travel from the cathode, remember from the cathode, from the tungsten filament to anode, result in the production of an increased number of X-ray. It's related proportionally. Increasing of the power, increasing of the number of energy of electron available from cathode, it will produce more number of X-rays. This one, a quantity is controlled by tube current. Quality was controlled by tube voltage. Quantity is controlled by tube current, and the unit is MA. We said the unit is ampere, but for this we use milliampere. So what's the milliamperage? Controls the quantity, the number of X-ray emitted from tube head. So milliampere determines the amount of electron passing through the cathode filament. Again, in the dental radiography, the use of 7 to 15 MA is required. No less than 7, no more than 15. Why? A setting above 15 milliampere is not recommended. What will happen? Excessive heat production in the X-ray tube, and the device will be crushed after many or not too many times. So because every time, the heat generated when produced X-ray, so over 15 MA, the number of electron available from the cathode to anode will be increased. So the number of the electrons hitting the target will increase. Consequently, heat generation will be too much. So the copper and the insulating oil cannot make this to be cooled. So it will be overproduction of heat, and the device will be crushed. An example, an increase of milliamperage from 5 to 10 MA. Look, the result will be twice as many electrons travel from the cathode and anode. So increasing MA, number of electrons will be increased. So the quantity of X-ray beam will be increased. So again, the quality is governed by kV and will increase the energy and penetrating power. The quantity is governed by MA or current, and the number of electrons traveling from cathode to anode will be increased. And again, we have to reach an agreement to set these parameters in order to get a good radiograph. No more than the required, no less than it. So consequently, twice as many X-rays are produced. Now, intensity. What do you mean by X-ray beam intensity? It's the product of the quantity, number of photons, which governed by the kV, and quality, energy of each photon, per unit area, per unit of exposure. So intensity depends on both quality and quantity, per unit area and per unit of exposure time. So I will start with the quality to know this governed by kV and will produce X-ray with higher energy and higher penetrating power. Quality was governed by current and depend on the number of X-ray produced. Intensity is product of both of these. This is the equation. Number of photons and energy of each photon divided by area and exposure rate or exposure time. These, just to understand what I mean, it's not like it will come in the exam to tell you write the formula, but just to understand it. Example, when you use higher kV, higher MA, and exposure time, consequently, you will get higher intensity of X-ray beam. So again, for every indication, for each indication of dental radiography, by setting angle technique, intraoral, and OPG, cephalometric, CBCT, we need a special amount or a required amount of intensity. No more, no less. It's not like, okay, let's set all kV high or MA high and let's extend the exposure time. This is wrong. You will not get a good radiograph. So we need to manage this. So now we will talk about factors controlling the X-ray beam. We talked about quality, quantity, and intensity. So what we have to control these, some of these will be a repetition and few of these will be a new thing for you. And I will talk about these new, not about the repeat one. So these factors are tube voltage, kV, we talked about that, tube current, MA, exposure time, we didn't talk in detail on that, that's why it's in red, so I will talk about it. Filtration, as you know, filtration, it will be filter the longer wave with low energy X-rays and will leave the high power or high energy with high penetration. So we talked about that as well. Collimation, we talked about collimation. It would collimate, and again, it will make the X-ray just oriented to the area of the interest, not diffused. So it will minimize it when we talk about round and rectangular collimator. So we don't need to talk about that more. Target material, we talked previously roughly in the target material. I will talk in detail about it. And the distance. Distance, I will talk about as well. So these are 7 factors controlling the X-ray beam. Okay. So exposure time, as you said, in the new dental machines, we just can't change the exposure time. But we have recommendation for each area. So changing the time, what you mean, changing the duration of exposure, at the end, the number of photons generated will change, either increase or decrease. If we extend the time, so the number will be more, or if we lessen or lower the time, so the number of photons generated will be less. So exposure time is doubled, number of photons generated is doubled. So again, it's like MA. So that's why I don't like to talk about MA and the relation between MA and the time, because you have a product talking is MAS. You might come across this if you read the textbooks, but for dental radiography, for your lessons this year, it's not required because it's more advanced related to CBCT and others. But I just want to tell you that we have a product called MAS. It's a combination of milliampere and time. So, target material. Of course, the target material have atomic number. So higher the atomic number of the target material, the efficiency of the production of X-rays will be greater. It's straightforward. So we talked about most of the target material is tungsten, but some of these might be molybdenum or silver. So why tungsten is more used? Because it has higher atomic number in comparison with the other. So at the end, the X-ray production or the efficiency will be greater. These are simple things, I think. Distance, this will need a bit more attention from you, because we will talk about important law relating to the distance, and this will be very important for patient or for the operator protection. So the intensity of X-ray beam reduced as the distance increases. This is straightforward. When you have source of anything, even light, when you are 1 meter away from the lights, the intensity is higher. Or heater. Now it is winter. When you sit in front of heater, it's too heat. The heat is higher. When you go away about 1 meter, it will be less. 2 meters less. It's the same thing with the X-ray. And this is it helps the humanity to decrease the harm of the X-ray, because it will have a limit. It will not go like kilometers without dispersion, without disappear. So the distance, the intensity of the X-ray beam reduced as the distance increased. So distance that must be considered when exposing dental radiograph. We have some things you have to know. This is the target, X-ray target. This is the skin of patient. Let's say cheek. if we talk about dental radiography. This is the area of interest or object or tooth that we want to take the radiograph. And this is the receptor or film. So you have some like target surface distance. Target to surface. So this is calling the target surface distance. Is the distance from the source of radiation to the patient's skin. Target to object distance. This is target. This is object. So is the distance from the source of radiation to the tooth or object or area of interest. These are very important to be understood because in the future, in the patient protection, we will talk about this because whenever you take radiograph for this object, there will be radiograph coming to hitting the cheek, soft tissue, and there will be ionization. There will be harmful effect. So you have to know what we mean by this. Last is the target receptor distance from the target to the film. So it's distance from the source of radiation to the receptors, either film or sensor. And you have another thing, it's called object to receptor distance. This is the object, tooth to receptor. These have effect on the taking radiograph. And when we will come to talking about bisecting angle technique and parallel technique, you will find this is very, very important. Both distances, target to object, target to receptor, and object to receptor distance. These are just for information for now about distance, but in the future you will understand this better when we come to talking about X-ray techniques. This law is very, very important. Inverse square law. The intensity of radiation is inversely proportional to the square of the distance from the source of radiation. Inverse proportional. تناسب عكسي. What do you mean by that? Source receptor distance increase, the intensity of the beam will be decreased. We talked about that. When the distance increase, so the intensity of the X-ray beam decrease. Don't be confused. When KV, MA, exposure time increase, the intensity will increase. But when the distance increase, the intensity will decrease. This is straightforward. And this is the equation for that. Initial intensity, final intensity, final distance, and initial distance. Because it is inversely proportional, so initial intensity will be on the up and the initial distance will be on the bottom. So I will just give you an example. When PID, cone, length is changed from 8 to 16 inch. This is very, very important for patient protection. Source receptor distance increase is doubled, 8 to 16 is doubled. According to the inverse square law, the resultant beam is quarter of intense. Look, when it starts to the end, when just changing the cone, the distance from 8 to 16, just doubling that, the intense will go back to quarter. This is the, after applying the formula, 1, the initial one 8, and the second one was 16. So the final intensity consequently will be quarter, 1/4. Just show you an image. This is the X-ray source. This is the phase distance. The intensity will occupy the whole area. Just going double, look, it will go to 1/4. Going another distance, it will go to another quarter relating to this one. So this is very, very important. Low, you have to understand it. Increasing the low, it's inversely proportional to the intensity. Increasing, doubling the distance, you will get like the intensity goes down by 2/4. So let's go just back, because in dentistry, in the dental radiography, in periapical, we have different cones. Most of these are 8 or 16. For parallel technique, 16 inch is recommended because the intensity will decrease, so the patient will get less radiation. We will talk about this again in the future when we go to talking about patient protection. So these information, look, every lecture, every future lecture will be based on the previous one. So unfortunately, I met with your colleagues on Tuesday in the clinic, and most of them as any student, we don't have time. We were students. We have responsibilities. But as students, in this tough time, Corona time, many problems in the country, and your parents paying a lot of money just to get a good qualification, and at the end you don't have time to read or to continue or to catch the information. So I think it's your responsibility. So as I said, every lecture it depends on the previous one. So I try to make these lectures again, again, again. I say it's simple just to follow up it. Because at the end you'll find yourself in a sea of information or in an ocean of information, and you cannot dive anymore. You cannot swim in this. So try at the beginning, just try to, as you say, play with water, try to go in a swimming pool, and then try to go to the sea and rivers and dive deeply. But if don't, so I cannot guarantee anything for you. So I'm thinking about doing a quiz maybe next week or week after. I will tell you later, just to push you or to press you to read these lectures from the beginning, because soon, after 1 month, you'll get mid-exam. So if you are not prepared from now, so you'll not have enough time in the future to catch the all information. I'm just talking about dental X-ray, so I don't know how about other topics. Okay? So this was the end of the first part for today. Any question before shifting to the second part, which is interaction of X-ray with matter? These are few slides, 5 to 6 slides. All of you are slipped, I think. No question, no comment. يعني واحد يسأل واحد يجاوب. Thank you.
الهوية مو
ايه تمام. على الأقل حسسونا أنه أكو interaction. تمام تمام أوكي. يعني واحد يظل الاونلاين كلش مزعجه، واحد يظل يحكي نص ساعه هو ما دا يشوف اي واحد، ماكو انتراكشن، فتحس انه دا تحاكي روحك. زين، مرات ما اعرف الصوت يوصل كله تمام، ما عندكم اي مشكله، البرزنتيشن كلها واضحه مو تمام؟ دير بالك لا تتخبط. زين. Okay, so we talked about X-ray production and the characterization of X-rays and KV, MA, everything. Now, when X-ray is produced, it will hit a matter. So the matter, we talk about medical X-ray, which we use for the diagnosis, and X-ray is used for many other different areas. So the matter here for us is patient or operator, we, dentist or dental radiographer or anyone going to the room when there is X-rays on. But for other specialties, X-ray, maybe they use X-ray to see the thickness of something. So the matter for them is something else. It may be paper, it may be wood, it may be iron or anything else. But overall, this interaction of X-ray with matter, it's for all of the matter. I say again, it's for all of matter. But at the end, we will make it more oriented to patient or to human. Okay? Some things, some like topics or some definition which are very important to be understood with the X-ray. You will hear about attenuation. So what do you mean by attenuation? Attenuation is the reduction of the intensity. Look, we talked about intensity, quality, quantity, intensity. Now it's the reduction of the intensity of beam as it passes through a matter. You have X-ray, it will hit the matter. So of course, the intensity of this beam, it will not be like the primary beam when it comes out from the tube head, from the first production of X-ray, going from the tube, X-ray tube, through the glass, through the filter, through the collimation, through the cone. This is called the primary beam. But when it comes out and hitting any matter, human or any other things, so it will be attenuated. So attenuation is the reduction of the intensity of beam. Okay? So for attenuation, we have three different things. Transmitted, these are attenuated photons. Transmitted, it's passed through the matter unaffected. يمر مرور الكرام. يخرج كما دخل. It hitting the target, hitting the matter, do no change, just going up. And some of these will not hit the matter, going beside it. Both of these calling transmitted, okay? Either hitting the matter and going out without change, or going beside it. Because when you take X-ray, for example, for patient, you will align the cone to hit, for example, upper premolar area. Some of these, if you don't have a collimator or this cone, some of these will pass beside the skin, beside the nose, beside the lip. So these will be transmitted. Some of these will hit the patient, will hitting the skin, the tooth, the receptor, and coming out from the other side unaffected. These are transmitted. Absorption, B here, is the transfer of energy from the radiation to the medium. The whole energy from the source of the radiation, it will be absorbed in the medium. Again, in the human body or in any other matter. This is absorption. Scatter, this is very important for patient protection, because some of the scattered radiation, it will just do harm for patient and for the operator. So scattering is a change in direction of the photon, with or without the loss of energy of photon. Here, the X-ray will come to the matter, hitting the matter, it will change the direction. So for scatter radiation, we have two types. I will talk about these later today. So just to know, we have transmitted, absorbed, and scattered from attenuated photon. Whenever photon comes here to hit the matter, it will be attenuated. So we have three types of attenuation. Attenuation means reduction of intensity of beam as it passes through matter. يا الله. صورة توضيحية بس راح تفهموها when I finish the lecture, but this will be like, oh my god, what are these? Too many information. Okay, so four possibilities can be occur when the X-ray photon interact with the matter. First of it, it's no interaction. We know every matter there is atom. Even human being, or any other matter, there is atom. So X-ray will interact with these atoms. First of this is no interaction, as you say. X-ray, this is transmitted and effected. A, no interaction. Just going beside the atom without hitting nucleus, hitting electron, doing anything. Just going out. Okay? And again, this X-ray, if it's not absorbed, not scattered, if anyone standing in front of X-ray beam, this one will absorb the X-ray. So it's too hard. We will talk about this later, as I said again. So first of all, it's no interaction. Two, it's attenuation. We talked about three types of attenuation. So attenuation, absorption of energy, Compton scattering, and coherent scattering. So here, look here, we set four possibilities. So it is no interaction, one, two, absorption, Compton scattering, and coherent scattering. So these are four. But here I did like no interaction and attenuation. And then from attenuation, we have three different effects will happen. So photoelectric absorption, B, I will talk in detail, just see the image. The C is coherent. I make it number 3 here because there will be an effect. No, sorry, Compton. There will be radiation, there will be an effect on the electron, and there will be a scattering. The coherent will be total scattering without any interaction with the atom. It seems to be difficult, but just let's follow slide by slide. You will understand it very, very well. You are clever, and I am sure you will understand it, but it just wants your attention. So no interaction. This is patient body. When we have two types of interaction, as I said. No interaction, that means complete penetration. The X-ray penetrates the patient's body and goes directly to the receptor, to the film. This is no interaction. There was no absorption from the matter and no scattering. Okay? We have another no interaction without passing through the patient, as I said. The X-ray will pass beside the area, beside the matter. This is called dispersion. Allow radiation protection for operator using inverse square law. This will be discussed in the future lectures. So just to know, when we say no interaction, third of this, when it's hit the matter without doing any interaction by complete penetration of the matter. The other one, however, is not related to interaction because it's not hitting the matter. But you have to know that we have amount of X-ray that will not hitting the matter, that will just going beside the matter. But for patient protection, for operator protection, it's very, very important to understand this. How I will talk about this in the future. But let's talk about no interaction when it is hitting the patient or hitting the matter. So no interaction means complete penetration. Okay? It's very, very important. The X-ray photons passes through the atom unchanged and leaves the atom unchanged. You have the body, you hit the patient, you have the film, you have area of interest, let's say tooth. So that all the photons pass through the atom without any change. It will make an image directly. So this is very important. The X-ray photons that pass through the patient without interaction are responsible for producing densities and making radiography possible. And this is our aim. When taking a radiograph, we want to see the radiograph, the film. We want to see the result. So if there is no penetration, if all X-rays interact with the matter, doing absorption, will not reach the film. Doing scattering will go any other direction except going to the film. So at the end, we will not get a radiograph. So this no interaction or complete penetration is very important to build a radiograph. This type of complete interaction, look, it counts about 9% of primary photons pass through the patient. يعني مدوغ نفسه نسوي X-ray, produce an X-ray, increase the beam intensity, and all of this. When it's come to hit the patient, only 9% of these will go and change. Will just hitting the target, hitting the material, going to the other side to hit the film and make a radiograph. Only 9%. And look at the other things. This is the no interaction. Absorption of energy and photoelectric effect. This is the second thing will happen. What we mean by absorption, interaction with a highly bounded inner electron. Again, don't be confused. We talked how we will produce X-ray. Again, by electrons hitting the inner bound and ejecting it, and at the end, a photoelectric X-ray will be the result. Again, when X-ray hitting a matter, there is an atom in the body. There is atom in the matter. So again, there will be interaction. So one of these is when incident photon hitting the inner shell. So this will go out, leaving the vacancy, and the outer layer electron will come to fill the vacancy, and at the end, photoelectric radiation will happen. So, as I said, it ejects the inner electron and the incident photon cease to exist. Now, this is very important. We have X-ray. The X-ray hitting the body or hitting this X-ray photon. We have a beam. Beam يعني حزمة. Beam of X-ray. The beam is consists of many photons, 1,000 billion of photons. So each photon, when hits an atom and cause an inner electron to be ejected from its side, at that time, this photon will be ceased to exist. يعني يتلاشى. This X-ray photon will end. It's not penetrating. At this point, when it hits the atom, this X-ray photon will be like khabar kana. It will be nothing, just do harm. It hit the atom, and many other reactions or many other processes happen as a result of this hitting of this X-ray photon to this atom. Okay? Consequence, it will be ionization of atom. And this is not, here it will be problem for the patient. Here it will be like things that we talk about harmful of the X-ray. So the next lecture will be radiobiology. And then we will talk about protection of operator and protection of patient. Look, this X-ray photon hitting atom and it ceased to exist, and ionization atom is happened as a consequence. So this is the pure absorption of X-ray. You apply the X-ray on the matter, it has been absorbed by the matter without any scatter, without any penetration. It ceased to exist by absorption or by making change in this atom, because this atom became ionized consequently. This count about 30% of interaction of matter with the dental X-ray beam. With the dental, The first one, penetration, was about 9%. The absorption of energy and photoelectric effect was about 30%. Okay? ما اريد اوهكم انه شو وقت هاي تصير بالهاير كي في لور كي في هاي ام اي بالبروتكشن راح نرجع شويه احكي لكم عليها بعدين. So I will talk about this in next or lecture, why this happened, high or lower kV, because today we don't have enough time. So just to know absorption, how it's happened and what its effect. We said you have two types of scattering: Compton interaction or Compton scattering and coherent. Why I left the coherent to the end, you will know soon. Compton one is the interaction with the weakly bound outer electron. So the photoelectric absorption was with the inner, highly tied electron. This one will incident photon come to the loosely electron at the outer shell. It will just eject this one, make a recoil electron, and as a result, there will be part of it scattered. So not all of the energy of the photon will be disappeared. Half of it will make an ionization, and part of it will be scattered. And we will talk about scattered radiation and the effect of scattered radiation on film and on the patient and on the operator. So it will be partial absorption of X-ray with scatter. Consequence of this, of Compton interaction, is ionization and a weaker scattered X-ray photon. So we have now partial, it's called Compton interaction, Compton scatter. Hitting the electron, loosely bounded one in the outer electron, partial absorption of it with scatter. So consequently, we have ionization and scattered photon. Look, it counts about 62% of interaction of matter with the dental X-ray. Again, this will work better with the high KV, and this will have its impact for seeing contrast or soft tissue. That's why it's easier to see soft tissue with using medical CT rather than using dental X-ray or dental CBCT. These are just rough information for you, but these have an advantage in a way to see the soft tissue by using X-ray. But it's not your business at this point, okay? Last one is coherent scattering. Again, transient interaction of electron. Incident photon come, hitting the electron. It will not eject it from its side. And consequently, pure scatter, no energy absorbed. Hitting this one and just going to the other side. So no ionization, but a scattered X-ray photon of the same energy. So incident photon hit electron, and consequently it's scattered with the same energy without ejecting any electron from the atom, without any ionization. And we will talk about this again in the future, about this scattering. So it counts about 8% of the interaction of matter with the dental X-ray. So these are the four main interactions: no interaction or transient, and photoelectric one, Compton, and coherent. Okay? The last slide is just an information about all these effects. Incoming X-ray photon, this is the matter. So the first one, photons transmitted unchanged. As it goes in, it goes out straightly. The second one, it's totally absorption by the matter. Photon totally absorbed is what's called photoelectric interaction. The third one, it's Compton, photon scattered after some loss of energy. There is some absorption, some ionizing radiation, and some scattering. And the last one, coherent, is the photon is totally scattered with no loss of energy. So these are the four main things happen when X-ray hitting the matter. So the secret to getting ahead is getting started. يوميا نقولها، ومن هسه اليوم الخميس راح يخلصون محاضرة، سد اللابتوب وعاد وين وانت موجود، وين سناب، وين فيس، وين الطلعات، هم حقكم بس هم انتوا حق الدراسة لأن هاي هم إلها حق عليكم. Okay. So next lecture we will talk about radiobiology and radiation safety and protection. This will be the topic for next lecture. And thank you for today and have a nice weekend. Any question? هم واحد يسأل واحد يجاوب. Good.